So then in 1975, you moved over here to the U.S. and started
Yes.
practicing here. And obviously, your brain was already going because it wasn't going to be long. It was just a couple of years later, right around 1980, when you got your first U.S. patent for the super plugger. So
Right.
it was, you were doing a lot of amalgams at the time. It was a
Right.
condenser. What was the inspiration for this instrument, and what?
When I was doing the amalgam plugging, and just to keep changing the instrument is tedious. So how can I do just one instrument for everything? So I just combined a very simple idea, combined the varnish ball and
Okay.
varnish it cone shaped, and make the packing and carving
Right.
with a one instrument.
Right. So now it was just kind of flipping it
Right,
in
just,
your hand
just
to be able
yes,
to use it.
and then I got a patent first.
Right.
And looking for the manufacturing,
Mm-hmm.
it was hard to get the manufacturing. But fortunately, one of the manufacturer named American Eagle
Mm-hmm.
accepted my idea, and they manufactured for me. And not actually for me. I licensed
Okay.
them. So they manufactured and they sold it.
And I think it sold pretty well, right? I remember
Yes,
seeing
it's
these. I know
good.
my dad had a couple of them. I used some of them. So
It's very convenient.
right.
So that company, American Eagle, actually they extended their facility to manufacturing my super.
Oh, it was so
plugger.
successful that they
Yes,
actually had
it
to
was.
develop
Right.
more production.
They brought
Okay.
that instrument brought good income for them.
Oh, good. Good. And it could probably be modified to be used on composites as well. I'm guessing
Yes,
that same type
right
of
now,
thing that's got instruments on both heads. You told me once that I was asking about your frustrations in dentistry. And you said another one of your frustrations was you would go in to do a hygiene check. Mm-hmm. And this was with your best hygienist. She had plenty of
Right.
skill. She was fantastic. But you would go in to do the hygiene check, and as you would look at the patient's teeth, on the lower anterior teeth, for example,
Right.
you would see interproximal stain, especially if the teeth were a
Right.
little bit crooked.
Crowded.
And you would ask her if she tried to clean it, and she'd say, yes, I don't have an instrument that would get in there. And I remember you told me you brought one of your ultra-fine gray strips over to her. And you said, here, we've already invented this, use this. And she refused because it would remove not much enamel, but a little bit of enamel.
Right.
Maybe 15 enamel rods or whatever it was. But your hygienist said, no, I'm not willing to remove any enamel to get rid of those stains. So I
Right.
guess she kind of forced you to invent the hygienist strip. Tell me
Yeah.
a little bit about that product and
Yeah.
how you developed that.
So when my hygienist finished the teeth cleaning and they called me for checkup, and whenever I see the stains between the lower front teeth, that bothers me a lot. I want to make the patient feels
Right.
completely done.
Right.
But when I saw the stains, no, it's not completely done. So can you remove this one? And Dr. Kim, I can't.
I tried.
can't.
Right, I can't do it.
I tried, but
You
I
can
can't.
try. Go ahead, Dr. Kim. Be my guest. Take a crack at it.
So, I should solve it. So that's why the hygienist strip came out.
So you needed something that wouldn't remove enamel,
Right.
but had enough of a surface that it would remove
Right.
the stain. How did you decide on the perforated design of that?
When I suggested first, can you use the gray strip? And she said, no, that removes, that's diamond surface. That removes the enamel. I cannot do that. Okay. And then any material not removing enamel, but removing only the stains. So that the idea came, so, how about the perforated? I have patented that, the perforated strip in my strip already. That is about 2004. So I have already patented. So, I could use that one. So I made just a strip perforated, and the surface, the edge of the perforation is really sharp. Even it is sharp, it's a stainless steel. It doesn't remove enamel, but it removes stains.
Right.
So I made a prototype, and I gave her. try to this one.
Right.
And she used that one, and she came to me. It works.
She said, "You did it. I will now clean the stain from every
Right.
one of my patients."
So I made that one for front teeth, but she uses whole mouth,
Oh,
whole
wow.
teeth. So whenever I see his teeth cleaning, the teeth cleaning is done, just perfectly clean.
Right.
So
It's such a great
that
product.
solved the problem.
Yeah, and hygienists are often the ones who suggest that maybe a patient should use chlorhexidine rinse.
Right.
But that stains, bacteria and will
Right.
get interproximally where the patient can't get unless they floss all the time. And
Right.
unfortunately, most of our patients don't floss that much. So for hygienists, especially who like to prescribe chlorhexidine for their patients, the hygienist strip is a fantastic way to get any of the additional stains
Right.
that occur because of that.